Hello everyone. In today's video, we're going to be talking about menstrual disorders. These are problems that affect a woman's normal menstrual cycle. But before I continue into this video, I just want to say that every woman's body is different. What might be normal for me may be abnormal for you. But then every woman knows her body. So when your body starts deviating from normalcy, you should know. There are people who experience cramps during their periods, but then there are people who experience excruciating type of cramps during their period. I mean, it is normal to have cramps when you're menstruating, but if it's excessively unbearable, then there has to be or there is an underlying problems. So in today's video, it is those disorders, those abnormalities that I'm going to be talking about. All right. So before we continue, let me officially introduce myself. My name is Priska. I'm a registered nurse. I live and I practice in the UK. My channel is all about nursing. I give health tips and I create health awareness as well. So please kindly do well to subscribe to my channel, like and share this video. So if you're happy, let's dive into the video. So the first on our list for menstrual disorders is the premenstrual syndrome. In premenstrual syndrome, a woman starts having signs of her period 2 weeks before the actual period comes out. I mean, you feel a lot of signs that may torment you so much that you even become scared of having the period. Okay, so the problems might be psychological or emotional, but then this problem torments you so badly that you may not even be able to do things for yourself. You may experience irritability, that is, you become irritable. Any small thing gets you angry, you get angered for no reason at all. Number two is fatigue, increased fatigue. You feel weak, you just feel weak, you do not have interest in doing things. Number three, food cravings. There are people who, before their period comes out, when they're having this premenstrual syndrome, they eat a lot, they consume a lot of food that on a normal basis they won't do such. Number four is bloating. Five, you have a lot of backaches. You've battled with a lot of backaches. Number six, you have headaches. You deal with a lot of headaches, which can be so very annoying. You feel depressed, you have constipation, you may not be able to be going to toilet the way you used to. You have diarrhea, you see, you have loose stool, you just be going to toilet anyhow. You have insomnia, you may not be able to sleep well. So all these signs, you believe with me that they can be very distressing, they can be so very annoying, they can disrupt your normal activity as a human being. So there are people who, before their menses comes out, they will start feeling sick already, because they know what they normally pass through before this period comes out. But sometimes if you check it, if you actually go to the doctor and complain, and when a proper test is run on you, you would find out that there is more to it, because your period is not supposed to torment you in this manner. You understand? So when you start feeling things like this and they become too severe, please kindly go to the doctor and complain. Your period is not supposed to even kill you before it comes out. No, that is not it. Number two is heavy periods, or the menorrhagia. Menorrhagia, like I said, is a type of period which is heavy. It is heavier than normal, in the sense that you bleed so much that you can even experience blood clots coming out of your body during periods. Of course, we all know that this is very abnormal. In some women, they use as much as 3 pads for just one period. I mean, this is too much. So when you experience something like that, just know that it is absolutely not normal, and you actually need to go to the doctor to make a complaint. It's mostly caused due to hormonal imbalances. So in cases like fibroids, some vaginal infections, you can bleed heavily. In fact, in people who have blood clots issues, they can bleed heavier than normal. So if you start experiencing this type of stuff in your life, if you start experiencing this type of changes in your menstrual cycle, do not hesitate to go to the hospital and complain to a doctor, because it is actually not normal. The next one is absence of period, like there is no period at all, or otherwise known as amenorrhea. In amenorrhea, there is no period. Your period is not coming. It has ceased. You are not seeing it. And it's been more than 6 months you saw the last one. Then there is a problem. Then you need to follow up. You need to go to the doctor to complain and know what exactly is wrong with you. Now, in amenorrhea or absence of period, it occurs mostly in some situations like number 1, in PID, which is the pelvic inflammatory disease. It causes absence of period. Number 2 is the premature ovarian failure. So in premature ovarian failure, it can result to absence of periods. Number 3 is after stopping birth control pills. You see, your period can cease temporarily, which it may come back later on, but you still need to go and tell the doctor. You still need to go and tell and report yourself, or you still need to report this case to your healthcare provider. Number 4 is in breastfeeding. People who do exclusive breastfeeding can experience amenorrhea. Okay? Now, in pregnancy as well, your period ceases in pregnancy and also in menopause. But to be doubly sure where this problem is coming from, just to get the right answer, when you start experiencing this problem, if your period has just ceased for no reason, and you know you're not breastfeeding, you're not pregnant, you're not approaching menopause, kindly let the doctor know so that they will know how to help you as soon as possible. The next menstrual disorder is the dysmenorrhea, or the painful period. Don't get me wrong. There are women who experience cramps when they are having their periods, which is normal for them. But then this type of cramps I'm talking about is that excruciating kind of cramps that you can't even deal with. This type of pain puts your life on hold. You can't do anything. This pain lasts, if your period is going to run for about 5 days, this pain lasts for 5 days. It's too bad. So you know that this is a problem. It is not normal. You have to go and report yourself or report this case to the doctor so that a thorough investigation can be carried out. Now, there are cases where someone can experience painful menstruation. For example, fibroids. People who have fibroid experience a lot of pain when their period is coming or when they are having their periods. Number 2 is in pelvic inflammatory disease. Yes, it causes excruciating pain during periods. Number 3 is the endometriosis. Okay, so please, because everyone knows their body, if you feel that this pain is not normal for you, you need to tell your healthcare provider so that they will know how to help you out. All right. And next one is the oligomenorrhea, or the scanty menses. Yes, because when your period comes out, it is expected to run for 4 days, and then you're expected to change your pads a couple of times because it will be filled up. You know the process. But in oligomenorrhea, it comes out in drops. I mean, it's just very, very scanty. It is so scanty that most times you start asking yourself, am I actually spotting, or is this periods? Please, you need to go and meet the doctor because it is actually not normal for you. You need to get checked. Some test has to be run on you to know where the problem is actually coming from. Like I said in the beginning of the video, everybody's body is not the same. Every woman's body is not the same. What is normal for me may be abnormal for you. But your ability to spot out a problem in your body is what makes you proactive. Okay? So your ability to know that this stuff that is happening to me is not normal. The earlier you report to the doctor, the better. So that these problems will start, so that they will start chasing these problems on time. Like for people who have painful menstruation, painkillers can be used to at least make this pain to be bearable. You can take some painkillers, some analgesics to help with the pain. Now, go to the doctors for this issue. They will ask you to go for some tests to know what is going on in your body. You'll be asked to go for an ultrasound to know what is happening to your reproductive organs. You would have to go for a hysteroscopy. Hysteroscopy is a situation whereby your womb will be visualized to know if there is any growth, to know if there is any problem at all that is happening. Sometimes some blood tests may also be carried out to know what is going on with you. In whichever way, when you go to the doctor to complain, you have to try to be as cooperative as possible so as to be able to get the best care. Okay? So, like I said, if you have watched this video up to this extent, please kindly subscribe to my channel